Hello, everyone, and welcome back to another episode of Stay Healthy San Diego. I'm so excited for this guest today. I have Miss Danielle Klee, who has a crazy background here. So hold on, I'm going to read this off. She's a part of the American Association of Speech and Hearing Certified Speech and Language Pathologist. She's California licensed speech language pathologist. She's an orofacial myofunctional therapist. We're going to talk about that in a second. She specializes in orofacial growth and development. She also works with patients of all ages, many of whom present with feeding and swallowing disorders, detrimental oral habits like thumb sucking, tongue thrusting, chronic mouth breathing, TMD, and obstructive sleep apnea. Her deep passion comes from her personal experience as a patient who lived with an undiagnosed myofunctional disorder for many years. Danielle, how are you doing today?
I'm doing so great, Matt, and I'm happy to be here.
Great. So Danielle, we met through a mutual friend. We went and got coffee, and then my mouth was pretty much dropped for the next 60 minutes because I just asked you a couple questions, and you so much love, so much passion for what you do. You even walked in today with donuts because you were part of a thumb-sucking party. Can we start there? Like, what was this thumb-sucking party, and what was that all about?
Well, officially we'll call it a 2 thumbs up party. And it's a party, I work with patients of all ages, but a big part of my job is working with young children and eliminating oral habits. I provide families and kiddos with a lot of information on the importance of good oral stages of development, and thumb sucking when you are at the age of speaking is something that we want to eliminate. So I help kiddos break their habits, and we had a 2 thumbs up party because one of my friends stopped sucking in 30 days. So there was music, there were donuts, there were prizes, his family was there, there were pictures. It was a lot of fun.
That's incredible because my mom back in the day had a similar issue, and she said how they used to deal with it was they'd put their thumb in incredible hot sauce or salsa, and then that ended that habit. So I'm glad to see that medicine has advanced a little bit and that the party went so well. But that's incredible, and you brought donuts. I appreciate that.
Yeah, of course.
But I want to backtrack here a little bit. You mentioned you're a speech language pathologist. Let's start there. What does that mean? What does that do?
Yeah, so speech pathology, a lot of times we're the people that bridge the gap. So in my scope of practice is speech, language, feeding, swallowing, and then also cognition, fluency, and voice. So it spans so many different people with so many different needs. But what I'm really passionate about is feeding and swallowing disorders, and even more so the ways that we breathe and how we place our tongues when we aren't talking or eating or drinking, how that impacts the way that our faces grow and develop, which has a huge impact on our quality of life.
So tell me, how does one get into speech language pathology? Tell me your story. How did you fall into this? What's your background? Your journey, yes.
Well, Rumi says that the wound is often the place where the light touches you. And that was just a true story for me. It's really, my burning passion comes from my own pain and my own experience. So I was my dream patient. I was a little 3-year-old who was still sucking her thumb. I had great parents who knew a lot and supported me in so many ways, but didn't understand how that could pose some problems later in life. So as a young girl, I ended up having multiple rounds of orthodontics. I had headgear, which thank goodness the majority of orthodontists wouldn't prescribe that anymore. We know that it has a negative effect on facial development and the airway. But by the time I was 12 years old, I was living with horrific chronic head, neck, and jaw pain every single solitary day of my life. So in the base of my skull, my upper back, I'd wake up in the morning and feel like my jaw had been locked all night. And I'm kind of a mover and a shaker, a type A person. So I tried to push through it, but by the time I was in college, it was debilitating my ability to spend time with friends, to participate fully in activities that I enjoyed, different forms of exercise, and really to be the best student I could be. So I always knew I wanted to be in the health professions, was on the road to become a nurse practitioner, and I was recently out of college and actually flew home to California to see yet another specialist who focused on TMJ, TMD, all the issues I was having. And you have to understand that I tried everything. I'd seen chiropractors, I'd seen osteopaths, I'd done yoga therapy, elimination diets, had tried everything, but nothing had really stuck and made a long-term difference. So I saw this dentist, and he took one look at me and said, "You have a myofunctional disorder. That means that you have a tongue thrust. Every time you swallow, you're pushing your tongue forward against your teeth instead of pushing it up to the roof of your mouth. You're a mouth breather. Your tongue is always low and on the floor of your mouth. Ideally, your tongue should be up against your palate, your lips should be together, and you should be nasal breathing. And a lot of the pain that you have in your face and jaw is because you're using all of this musculature incorrectly. You need to see a myofunctional therapist. So I sat there and was like, there's no way that this is this simple or this easy, but I'll go with you. I'll try it. So we drove out to Pacific Palisades and ended up meeting a woman who's become a mentor, a dear friend, and really an angel in my life. And she listened to me talk about my symptoms and showed me video after video of patients who explained the same pain patterns as me. And my mom was with me, and the two of us cried. I'd never met anyone who understood what I was dealing with. And I said, I'll do whatever this myofunctional therapy is, I'll do it, because I can see from these before and after videos that it actually makes a difference.
Incredible. So I'm curious, there's this almost like hidden science here, this myofunctional therapy. What's the difference between like speech language pathology and this myofunction? Is there
That's a great question.
difference, a similarities?
Sure.
Like what's
So in America, there are two different professionals that typically practice myofunctional therapy. One is a speech pathologist and one is a dental hygienist. A speech language pathologist has specialized training in feeding and swallowing, which is why I decided to take the route of speech pathology to do myofunctional therapy. I've worked with patients with a variety of other different feeding and swallowing disorders, which can be comorbid or exist at the same time. But yeah, that's how I ended up on this path. I had talked to my mentor. The long story short is that I started therapy, Matt, and within the first week of therapy, I immediately noticed a difference in my pain. Within a month, I noticed a 40% reduction in my pain, and within 2 months, 75-80% reduction. I started going to lectures on the weekends, reading books. I changed my whole career path and the trajectory of my life. It so radically impacted my health.
That is I keep using the word incredible. I need more vocabulary here, but like just the fact that you had it and you found someone and you kept like battling to find your magical angel and your practitioner, and it ended up working out. So congratulations. And it's so incredible because you've made it this entire career where you're helping the kids stop the thumb sucking and you're doing all kinds of wonderful things. So I want to keep pushing this a little bit further. You're doing the myofunctional therapy. I mean, most people, right? I'm going to backtrack here. What I want to move into is sleep apnea, because that's the one I have quite a few patients on my end with sleep apnea. So I'm curious, because that's something you actually work on. It's not just a CPAP mask and medication. There's more than just...
or maybe it'd be helpful to explain to people what myofunctional therapy is and how it relates to that.
Perfect.
Just kind of, I know, because we're throwing around a lot of terms, and I want people to feel like I can get this. And that's always my biggest goal with my patients, is that they can explain it to friends and family, and there's a why behind what they're doing. So what I teach people to do is how to put their tongue on the roof of their mouth, how to have relaxed lips and breathe through the nose, and how to swallow with that vertical tongue pressure. And an even deeper step than that is how to use the right muscles when they feed and swallow. Sometimes you'll see people who almost make a grimace. It's like they're recruiting all the muscles in their mouth. If we were on video, I could show you.
I'm terrified. Like, I don't want to eat next to you now.
To swallow funky. But I help people learn how to kind of come back to baseline. And the way that connects to sleep apnea and some of these other health issues, sleep apnea, TMJ, clenching, grinding, is that a lot of times these individuals are experiencing dysfunction of the muscles of the mouth and the face, and those related to the airway. So when it comes to sleep apnea, you think about your quintessential sleep apnea patient. Oftentimes they're a mouth breather. Their tongue rests on the floor of their mouth, and there might even be something related to enlarged tonsils or adenoids, or something compromising their airway. So I'm often a part of an interdisciplinary team. I myself don't treat sleep apnea, but a lot of my patients have a lot of the issues that I do treat, and they end up seeing a significant decrease in their AHI numbers, a decrease in their snoring, and an increase in their quality of life. And there's a lot of peer-reviewed research to back this, actually from Stanford Sleep Medicine. And if you go to my website, daniellekleeslp.com, I cite a lot of these sources. They'll take you to PubMed so you can read some of these articles. But it's similar to TMJ. So I was your quintessential TMJ patient because my tongue was always resting on the floor of my mouth, because I was tongue thrusting and mouth breathing. I was over recruiting a lot of the muscles in my jaw and my face. And by doing myofunctional therapy, similar to what research shows us, a decrease in myofascial pain, an increase in my jaw's range of motion, and an increase in my overall quality of life.
Tell me a little bit more about the other things that you see. You see sleep apnea. You see what kind of things that people may not expect.
Ooh, so this is interesting. So connected to disordered sleep breathing, enuresis or bedwetting. So it's not uncommon for children who have disordered sleep breathing to also wet the bed. And that's because wetting the bed is the body's way of saying, wake up and breathe. So interestingly, some of my kiddos that I work with who are chronic mouth breathers, who snore, who have some sleep concerns, while, of course, I encourage them to get a sleep study done, but while they're doing myofunctional therapy, we'll see an improvement in sleep, and it's not uncommon to see a complete elimination of bedwetting. And that's true of many of my colleagues, and there's been research published on this as well.
That is absolutely fascinating. So
it's awesome.
Breathing linking to bedwetting. So
it's empowering for kiddos who think that it's their fault, that they're not trying hard enough and feel really embarrassed about it. And that's the best part, is providing the education to the child too, so that they feel motivated to do the exercises, to learn to nasal breathe. And then they see the elimination of this habit that impairs their quality of life and, their ability to go to sleepovers and stuff.
Must be a powerful feeling after that.
It's exciting, yeah.
Absolutely. So
I'm really thankful.
Yeah, so let's walk through the process a little bit. So I have a kiddo that may be bedwetting, or I have a client that has sleep apnea and they come to see you for the first time. What does a workup look like? Are you putting your fingers in my mouth? Is it going to hurt? Tell me a little bit more about that, how it looks like.
Sure. So a lot of my referrals come from dentists or someone like you who maybe has observed some of these issues. And what'll happen is they'll come into my office and we do a really thorough patient interview. So I ask about a lot of things, what their birth was like, what types of habits they had as a child. So even with an adult in their 60s or 70s, I'm asking, did you suck your fingers? When you did suck your fingers, was there a trigger? Did you have a blankie? How long did you suck your fingers? Okay. I'm also asking a lot of questions about their dental health and history. Did you have your wisdom teeth removed? Do you have chronic TMJ? I'm asking about their sleep health as well. And then we launch into what's called a dysphagia evaluation or a bedside swallow study, which is really just like a picnic.
And what's dysphagia, so we can
So
tell
dysphagia is disordered swallowing.
Okay.
And that's essentially, I have a patient eat 4 different consistencies of food, and I just watch the way that they eat. And I love this part of the assessment because it's functional and it's real life. When you're an adult, you hardly ever look at yourself in the mirror when you're eating. So there are lots of different data points that I can pick up on that a lot of even my most self-aware patients maybe haven't noticed.
Such as
like the grimace we were talking about.
Okay.
Grimacing, licking the lips after every swallow, pushing the tongue forward against the teeth and tongue thrusting. And a lot of times my patients who have a myofunctional disorder feel embarrassed about the way they eat, or their kids who parents have said, we've sent them to cotillion, we tell them to eat with their mouth closed all the time, we don't know what's going on. And a lot of times when it's a root issue of muscle dysfunction, myofunctional therapy is incredibly helpful. So sometimes you hit 2 birds with one stone, and grandma's proud that they're using good manners at the table after therapy as well.
But essentially they can breathe a little bit better and they're able to use the musculature correctly.
Yes.
Awesome.
Oh, and then the last part is, and I'll do an oral mechanism exam. So to take a look at their airway, their oral structures, their teeth. So I'm looking for things like enlarged tonsils, adenoids, if they have a deviated septum, because those are some confounding factors where we're going to want to get an ENT involved or a sleep specialist to make sure that the whole patient and their needs are being addressed.
Understood. Tell me more about the sleep studies and how you analyze that data, or how you work with the interdisciplinary team. I'm curious.
Well, when I had the patient come in, I recently had a child come in who parents were reporting that the child was stopping breathing multiple times in the middle of the night. A lot of times that's an education piece, and educating the family on why it's so important to get these types of tests done. Children should not snore. If an adult is loudly snoring and having apneic episodes that, choking on the tongue in the middle of the night, you need to go and get a sleep study immediately. I don't interpret that data or the results, but I make sure that once we get the data, we make it a part of our treatment plan, and I'm in conversation with the sleep specialist. In terms of an ENT, they're a huge part of the puzzle. If I have a patient with massive tonsils that are almost touching, that's something that all the myofunctional therapy in the world really really can't remediate. We can teach them some strategies for nasal breathing, which may help with a little bit of inflammation, but sometimes we need to get an ENT involved to tackle that issue, or an allergist. I had one patient who was a chronic mouth breather until he gave up dairy, and it was like his airway and his nose completely cleared. And so for him, then we were able to teach good tongue posture after.
Okay. So you do a plethora of things.
What I love, I've been a patient that's been passed around from person to person to person. So I love being that investigator, and I love helping patients with the tools that I have, and then giving them awesome referrals to meet the needs that are showing up that aren't in my scope of practice.
Understood. Well, let me ask you this. Are there mistakes that people make when it comes to maybe teeth grinding or sleep apnea? Something you see that people should stop doing, maybe that's a common advice that is given out there?
That's a loaded question. I think that we live in a culture where we assume that a lot of these issues are normal and typical. And that's where we need to backtrack. There's been one of my favorite books. I'm going to give a plug for this. So if you're listening and you want to learn more, check out the book on Amazon, Jaws, A Hidden Epidemic. It talks about how there's been such a profound shift in the development of the lower mandible just in the last 100 years. And they have pictures of a grandpa, a dad, and the son, showing how, grandpa has a strong jaw and the son, the youngest, has a really retracted jaw. And I would argue the result of that is environmental factors. And so before we start asking, should I have a night guard? Should I not? Is this therapy good? Is that therapy good? The real question is, what are we doing as humans to cause these problems, and how can we prevent them in generations to come? And I would argue that it has to do with early feeding and swallowing when our children are just out of the womb. And those are things that we can all participate in today.
So elaborate a little bit more. Like, what do you mean about the early feeding and breathing? Like, as we're like for like, right? So if I'm a parent and I'm like, oh my gosh, Danielle, you're telling me all these scary things. Like, how is there a certain way that we should be feeding or encouraging, or am I going down the right pathway here? Like, how would you recommend actual advice, maybe?
So actual advice, well, we start just with the baseline of telling a parent what's epigenetics. Epigenetics means that your genetics are influenced by environmental factors. So we're living in 2020. We live in a world with a lot of modern conveniences that didn't exist, not to mention 500 years ago, but didn't even exist 50 years ago. And these conveniences are having a big impact on the way that our faces, our airways, and mouths develop and form. And that's because we swallow 500 to 1,000 times a day, right? I know that for you, Matt, it's like squatting. Yeah. You see somebody squat with bad form and you're like, you're ruining your back.
A little bit, yes.
Yeah.
Or watching people walk kind of haunts me sometimes. So
yeah, and breathing is the same thing, 28,000 breaths in a single day. So the way that we do these things, not just if we eat, drink, and breathe, but how we eat, drink, and breathe has a huge impact on how our structures develop. So when it comes to babies, one of the biggest things I encourage is a book. If you have a typically developing child, of course, if your child has needs, I will give you the speech pathologist site on that if you want to email me. But for a typically developing kiddo, by the time that they're sitting upright independently, they're ready to take solids. And there's a method of feeding babies called baby-led weaning that I love. You can buy the book. It's on Amazon. It has great reviews, and it talks about ways to safely introduce solids to your child so that they can have a sensory experience of the food, and so they can start practicing things like tongue lateralization, chewing, rotary chewing, and these movements of the mouth that if we keep kiddos on purees or on pouches, they really aren't getting access to. And that's the biggest thing that I see. We are in Encinitas. There are so many health conscious, wonderful families in this city and this community, but a lot of people eat almost everything in smoothie or food bar form that doesn't require a lot of chewing. You can basically just stick your tongue up to the roof of your mouth a few times and absorb all your nutrients. And we're forgetting how important things like chewing our food are.
You mentioned the environmental factors, things that weren't existing 50 years ago versus that. Like, tell me more. There are more environmental factors we need to be on the lookout for, because I love that book. So
that's when thumb sucking and oral habits comes up.
Gotcha.
So that's another big one. So thumb sucking's happened for a long time, but I would argue to you that by 10 months of age, Diane Barr, she's my mentor, she wrote a book called Everything My Mother, or Nobody Ever Told Me or My Mother That, another great book on Amazon if you're a young, parent or caregiver. But she argues that oral habits should be eliminated by 10 months of age. A lot of people don't know that. I see 4-year-olds walking around with pacifiers, but I'll tell you why. Tongue thrusting is normal if you're a baby who's come out of the womb. It's normal to push the tongue down and forward when you're trying to drink from mom's breast. But by the time a kiddo is at 9 or 10 months of age, they're starting to develop the skills to eat solid. So they're moving their tongue back and forth. They're moving the jaw to chew. And so we want to empower them to chew. I have a line with my kids where I say, sucking is for babies, but chewing is for big boys and big girls. And that's so important. And I just don't think a lot of parents have a knowledge of how important chewing is, and how when kiddos are putting everything in their mouth, that is an awesome sign, and you want to support that versus reduce it.
Okay. So you got me spooked now, Danielle. I got to if I have a kid, I got to make sure I read all these resources. No. I'm glad you're here. That's why I have you on the podcast. Do you know what I learn these kinds of things. I know what books to read, so I'm a big book reader. So, and don't worry, I'm going to put all these in the show notes, by the way. We'll link it out to Amazon, all the book recommendations that Danielle just shouted out. So, just absolutely incredible. Where can people find you, Danielle? We want to work with you. I want to follow you. Where do I go do that?
So people can go to daniellekleeslp.com. My email, daniellekleeslp@gmail.com. And then on Facebook and on Instagram, it's Danielle Klee SLP. Tried to keep some consistency there.
I like it all the way across the board. Again, that's going to be all in the show notes. And then, of course, we are a Healthy San Diego podcast. I want to talk about San Diego a little bit more. You're born and raised here.
I was.
So I want to know, first, your favorite activity, and then second, I want to know your hidden gem restaurant that most people don't know about.
I have a lot of favorite activities. Okay, I love to hike, yoga, skate ski,
I want to talk more about the skate ski, because of course, hiking and yoga, right? Very common here, but tell me more about skate skiing. We talked about it a little bit before the podcast started, but I want to hear more about it.
I lived in Boulder, Colorado for a couple years, one of my second favorite place in the world, and took up skate skiing. And I was telling Matt, I had a lot of hip issues and took up skate skiing and was able to start running because it's all lateral glute exercise. You have to have perfect form. You've got to hold your pelvis like a bowl that won't spill water.
Makes me so excited to hear all this.
And you burn everywhere. So I would tell you, they have rollerblades that you can practice with here. And then if you go just up to Big Bear, right outside Big Bear in Running Springs, they actually have a Nordic track. You just got to make sure that there's snow. There's not any up there right now.
Okay, so if I want to skate ski, you recommend starting with rollerblading and then I transition into, is that like the easiest, or it's ice skating? I don't know.
I'd maybe say try it out up at the Nordic track. Definitely do a lesson because you want somebody giving you good form. You can't do it if you don't have good form. And if you've got a weak core and weak glutes, it'll be tough. But if you want to continue it down here in the off season, there are these cool like roller skis that go into ski boots that you can Google videos of Norwegians, doing it in the summer.
I gotcha. Skate skiing in the summer. Yeah. I understood. And then your hidden gem restaurant.
We love Kyoto on the 101.
Okay. Tell me.
It's fantastic. It's Peruvian food, and it's absolutely amazing.
What do you order when you go there?
I like the skirt steak with the quinoa and the grilled vegetables, and they have these root vegetables. It's like a different type of potato that they saute and fry up, and then they also have fried plantains with homemade sour cream.
Wow.
And really delicious wine. Yeah, that pairs well with it. So. Okay.
Red, I'm assuming.
Yes, okay, red with the steak.
I'm not a big wine person. I just got to figure out. Yeah, I took a guess, 50-50, so I'm glad I nailed that. But Danielle, anything else you want to leave with the audience before we wrap up? This is so incredible. I'm glad you came on today.
Well, I just want to leave people with a place of positivity and hope, especially when we're talking about what environmental factors are changing the ways that we develop. The great reminder is that less is more. And when it comes to having an infant or a baby, you'd probably agree. Put them on the floor. They don't need to be in a bumbo chair. They don't need to be in a bouncer. Put them on the floor. They're going to figure out how to roll over, how to sit up. And it's really the same thing with a baby from my perspective. There's so many things parents naturally do that are awesome for the development of their kiddos. It's just tweaking some of that. And it's kind of coming back to our ancestral roots and some of the wisdom that I think has been lost as we've progressed as a society. So to my adult friends out there too who maybe deal with some of this chronic pain, I just want to affirm you and encourage you that there's hope for you as well. I've been in your place, and I believe that there's relief for you too.
And of course, reach out to you because that's what I'm going to do. So Danielle, thank you so much for being on today, and have a good one.
Yeah, thanks.
That was awesome.